I am Sivaram Krishnan and I am 80 years old. I am a retired technical professional and I have been staying in Bangalore for almost 20 years now. I used to suffer almost for the last 5 years with heavy breathing whenever I make some 20-30 steps of walking, and I was unable to climb up any staircase or anything. And I needed always someone to help me. One fine morning I had very heavy breathing problem and I came down to Manipal Hospital at Sarjapur Road. Dr. Suraj Narasimhan took me through the various diagnostics like the ECG, echo testing and other tests.
I am Dr. Suraj Narasimhan, Consultant Interventional Cardiologist and Structural Interventional Specialist, Sarjapur Road, Manipal Hospital. So this patient, Mr. Sivaram Krishnan, who is an 80-year-old gentleman, who came to me with complaints of breathing difficulty, and this breathing difficulty has been there for him for almost 6 years now, and it has gradually worsened, and right now he is only just able to walk few meters. With that itself he has become breathless, and he also had complaints of chest pain, for which I evaluated him with the multiple investigations like ECG and an echocardiogram, and we found out that the main problem for him was actually the aortic valve. The aortic valve has been narrowed, and that is the reason why he has been having this complaint.
He found that the valve was very narrow and pumping capacity became less. So that's the reason why I had difficulty in breathing and I was not very comfortable during walking.
And because of the long duration of the disease, this aortic valve narrowing has resulted in reduced pumping of the ventricle, and he is also having heart failure symptoms. So basically, after evaluating him and then coming to a diagnosis of aortic stenosis, the only treatment which is available for him as of right now is to go ahead and replace the aortic valve.
He suggested that the valve need a replacement, and he gave me two options. One was an open heart surgery and another is the most modern surgery.
So basically we have two options to replace the aortic valve. One is the surgical aortic valve replacement, the other one is called as this transcatheter aortic valve replacement or implantation, that is what we call as TAVI, TAVI or TAVR, TAVR. So considering his old age and also his comorbidities like hypertension, he is also having a weight of around 103 kgs, he is obese and he had a mild renal dysfunction, his kidneys were also not functioning properly. So considering all these factors, we decided that transcatheter aortic valve implantation is a better option for him rather than to go for open surgeries.
The doctor suggested open heart surgery will not be encouraging. So he suggested that go for the second option, which needs no surgical operation, needs only staying in the hospital only for a shorter duration. And because I had a history of stroke, he suggested open heart surgery is simply ruled out. So we went for the second option and I got admitted into the Manipal Hospital Sarjapur Road. There I went through the procedure just one day after I got admitted. The next day I was in ICU. Later I was moved to the ordinary ward. From where the next day I was discharged.
The problem with doing an open surgery on an 80-year-old gentleman is that the morbidity and mortality associated with open surgery is very high, and also the recovery period for an 80-year-old gentleman is actually longer than for younger people. So we suggested this transcatheter aortic valve implantation to him, and the patient also opted for the same. So after doing a CT scan and the coronary angiogram which were all normal, we took Mr. Sivaram Krishnan for the procedure, and successfully we completed the whole procedure within 45 minutes under local anesthesia. The patient was shifted to ICU, kept under observation for a few hours, and after 6 hours he was able to walk on his own. The next day he was shifted to ward. Within 48 hours he was successfully discharged from hospital.
I have lost heavy weight and I was walking through easily. During the procedure, I was half awake and I was able to see the procedure happening inside. Earlier days, I used to find it very difficult to walk even some 30-40 steps. Now I am able to walk for an hour or more even. So I am feeling very normal. The speciality about this procedure is, I feel nothing has been done inside my heart.
And we found out at the time of discharge that the new valve which we have implanted was working perfectly. The gradients have come down nicely. There was no leak and there was no need for any pacemakers. And the small hole which we put in the leg was actually healing well, and there was no bleeding from the access site. The whole procedure, the TAVI, is actually pain-free, scar-free, and it is much safer, especially for older gentlemen like Mr. Sivaram Krishnan. And I am very happy to find him after 2 months after the procedure. He came to my OPD and then he told me that, sir, I am able to walk for 1 hour without any complaints. I am very happy for how the procedure went and how much improvement the patient has had after the procedure. And I am also grateful that these kind of new technologies are actually helping older patients with much more severe disease, which can be treated by a much simpler approach like this TAVR.
I owe a lot to Dr. Suraj Narasimhan and this hospital, who made me very comfortable in my day-to-day activities. Now I am actually doing all my day-to-day activities myself without depending on anybody. I thank once again Manipal Hospital Sarjapur Road and Dr. Narasimhan, his team. Thank you.